Hello, everyone. Welcome. Before we get started here, we do have some polling questions for you, just to get a sense of folks who are joining us this afternoon. So I'm going to go ahead and ask you the first question. So if you're logging in on your computer, go ahead and click which one best represents you. Give another 20 seconds or so here to finish if you haven't already. Seeing a really good mix of people with lived experience, people in recovery, clinicians, and other folks, a good mix of folks. So 5 more seconds to complete and we'll close this one. Okay. Next one. Getting a sense of whether you live in more urban areas or more rural areas. Another second. About 80% of us are from urban areas and 20% from rural. We did circulate this invitation nationally, so getting a sense of where you're from. Perhaps we have international folks as well, so go ahead and answer this poll. 5 more seconds. About 80% of us from British Columbia, and the other 20% from another area outside of BC. Last but not least, final question for you here. Five more seconds. All right, so seeing that we have about 33% of folks who have been affected by COVID-19, and we'll be addressing this particular point later on in the webinar today. So we're gonna go ahead and get started. So if you're here today to listen in on a webinar on initiating and maintaining recovery during public health crises, you've made it to the right place. Before we fully dive in, though, we do want to take a moment to respectfully acknowledge the lands in which we're working and listening in from today. And so I'm doing this acknowledgement on behalf of my colleagues in the Vancouver area. So we're on the traditional territory of the Coast Salish peoples, including the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh First Nations. However, recognizing that we have folks from all over BC and other parts of Canada, just take a moment to reflect on where you're calling in from and the lands in which you're working or playing or listening, and just reflecting and being grateful for having that opportunity. So here is our recovery series. So you may have seen that we have a 4-part series for this discussion, and today we'll be focusing really on the initiating and maintaining recovery. We have folks with diverse backgrounds, as you saw from our poll, leaders, healthcare policymakers, persons with lived and living experience, and family members. And so we'll be addressing specific recovery items, but in relation to COVID-19, homelessness, unemployment, overdoses, of addiction throughout this webinar series. And this is the format today. So really, we're going to try to leave most of the discussion for Q&A. There will be opportunities for you to ask your questions as well in the chat function, but we'll get to that shortly. So I'm going to jump into doing the bios for our guests. So you can go ahead and read the full blurb in the interest of time, but we have an amazing panel for you today. So the first being Rebecca Jessamine, who is the Director of Policy from the Canadian Centre on Substance Use and Addiction. And she currently serves as the chair of the Ottawa Carleton Detention Centre Community Advisory Board. Thank you for coming, Rebecca. Next, we have Guy Filicella, who works not only for one, but three organizations. So the BC Centre on Substance Use, Vancouver Coastal Health, and the Ministry of Mental Health and Addictions Overdose Emergency Response Centre. And he serves as the peer clinical advisor and is a passionate advocate for peers across the province and the country. He often says, I wouldn't be alive today without harm reduction services, and I wouldn't have the life I have today without recovery. Next, we have Scott Gue, who is a person with lived experience, and he's been a person in long-term recovery from substance use. Born in Vancouver, Scott started using drugs at the age of 12, and by the time he was 15 years of age, he was living in active addiction. So Scott will be speaking to us about his lived experience and how that's been impacted during crises. We have Jessica Cooksey, who's the operation manager at Last Door Recovery Society. She's a member of the BC Addiction Recovery Association, the POTSP committee with the CSU, and Fraser Health Authority Substance Use Network. We also have Carson McPherson, who's the executive director at Cedars at Cobble Hill, which is a residential addiction treatment facility on Vancouver Island. He also sits on the National Policy Committee for the Canadian Society of Addiction Medicine. Lastly, we have two moderators today. So myself, I'm Amanda Giesler, and I work at the BCCSU leading our education team. And then we also have Giuseppe Ganci, who's the Director of Community Development at Last Door Recovery Society. And so he's going to be walking us through the Q&A with the panelists, and we'll be hosting the rest of this webinar. So with that, we are going to move into our panelist Q&A portion, but we do invite you, as you're listening in to these conversations and the respondents from the panelists, if you have questions that you would like to have addressed or you have a point you would like to make, please let us know and type it into the chat function. We're going to leave about 10 minutes or so we can address some of those, so please do go ahead and feel free to list them. But with that, I'm going to pass it over to Giuseppe to walk us through our panel discussion. Thanks, Giuseppe.
Thank you very much, Amanda, and thank you very much to the BC Centre on Substance Use for giving us an opportunity to talk about recovery during dual crises, especially during COVID-19. So I really want to thank you and giving us the opportunity, and thank you for the land acknowledgement as well. I'd like to welcome everyone on our panel today. Thank you for taking time out of your day, and to all the attendees, thank you very much for also taking time throughout your day to be part of this conversation that will help us strengthen recovery in BC and also in Canada. First, I'd like to start off with Rebecca. Hello, Rebecca.
Hello, good afternoon.
Good afternoon. The Canadian, the CCSA has done many different projects in regards to substance use in Canada and also recovery. And a long time ago, I read an amazing definition of what recovery is. And from a national point of view, to bring us to the full national perspective, what is Canada's national view definition of recovery?
So to be honest, we don't really have a nationally agreed definition of recovery. So perhaps I can pull out some highlights of what we're talking about when we think of recovery. And these primarily draw on a gathering that we had in 2015, where we brought a range of partners together to develop a commitment to recovery in Canada. And we spoke about recovery as a process that aims to improve quality of life by seeking balance and seeking healing in all aspects of health and wellness. So connecting not just physical health, but also social, mental, and emotional health. We recognized that what that process looks like and what balance looks like is going to be different for everybody. But the key message is that recovery is real and recovery is attainable, and that we're committed to making it more accessible by reducing stigma and promoting a person-centered system of services and supports that's based on collaboration and partnerships.
Now, COVID-19 has taken over the airwaves when it comes to the news, when it comes to social media. You know, every day before March 13th, it seemed like everybody was talking about the overdose crisis, fentanyl, the illicit drug market. And I was in Ottawa on March 13th, you know, at a symposium discussing, you know, substance use and so forth. Has COVID-19 changed the national conversation. How's COVID-19 affected the national conversation when dealing with substance use in Canada?
I think that it's overwhelmed the discussion, as it has every other discussion virtually on the planet right now. But it's so important to remember that the overdose crisis continues in the context of COVID. We've seen numbers in Toronto and in BC that there's been an increase in overdose deaths between February and March, which is when the pandemic started to take hold. Another thing that we really need to be mindful is the risk of increasing stigma. So people who use drugs cannot be viewed as disease vectors, and we really have to challenge the idea that people are receiving handouts or wasting healthcare resources. Public health responses need to address all populations, and there's a risk that vulnerable populations might slip through the cracks or be adversely affected in ways that we might not anticipate when we're working at the broader public health level. The services and supports that we know save lives and reduce harm and connect people to care and supports are facing such a huge, enormous pressure because of all of the overwhelming attention to COVID and resource investment in COVID. But many of these supports have had to reduce emissions. They've had to potentially close. They may not have the capacity to obtain personal protective equipment for staff, for peers, and for clients. So these are considerations that we really need to be thinking about. So in terms of how COVID has changed the way Canadians see the crisis, hopefully through messaging by groups such as ours, we can help Canadians understand that addiction is a health issue and that there's a large body of evidence that supports the importance of harm reduction and services and supports to substance use in the context of the broader pandemic.
There's lots of stakeholder meetings taking place across the country, locally, provincially, nationally. I think Rita's in a national conversation right now today too. That brings us together, and recovery is all about being connected and connected to people, community, healthcare, and so forth. What are some of the recommendations that CCSA has compiled a list, or what conversations are out there so we can stay connected during these times, and any recommendations that has been created by the CCSA?
So we need to recognize that a return to normal is not something that is immediately in the cards. So we need to really be looking at options that we can sustain over the coming months, perhaps into the next few years. And those options need to respond to people's needs and protect their health. And that can be as simple as having somebody that you trust that you can pick up the phone and talk to. We've seen a huge scale up in virtual services. I saw numbers from the Centre for Addiction and Mental Health in Toronto that had gone from 350 virtual sessions in a month to over 3,000. So that's a great step, but we need to also recognize that not everybody has access to devices, to phone plans, et cetera, in order, or even a private space to access virtual care services. So we need to make sure that we have supports around those access to those services or to alternatives. And we also need to make sure that whatever's being done is being done in an evidence-based way. So what are the qualifications of the person on the other end of that phone when you do reach out, for example? In addition to the virtual service scale up, it can be just looking at public health and safety practice that aligns with what we're hearing from the public health officers. So that can be provision and training of personal protective equipment. It might mean smaller groups. So it might mean staggering group meetings over different time periods, or holding them, for example, in larger facilities to allow more space between people.
And if any of the attendees have any suggestions on how we could improve conversations with people that are using substances or looking for recovery, please, feel free to put that in the chat, and we'll review all of that later on. We've got about a minute left. The CCSA did a report, Life in Recovery. Almost impossible to put a review on that in less than a minute, but can you highlight some outcomes for Life in Recovery?
Key message: recovery is real, recovery is attainable. But we really need to be mindful that stigma is a significant barrier to seeking and to receiving support. And it's something that we need to be particularly mindful of right now.
Well, thank you, Rebecca from the CCSA. Later on, there'll be a slide presentation with some resources that the CCSA has nationally and provincially. So thank you very much. And Rebecca will be back part of the Q&A later on. If you have any questions for Rebecca, please feel free to add it to the chat. We're going to move on to Guy now. Hello, Guy.
Hi, Giuseppe.
Wish we could see each other person to person, but this is where we're at. You know, thousands of people have heard Guy's story, whether it's been online, TED Talks, all the way down to the schools, and much respect to the conversations you have on a daily basis with people that are still using and spreading hope. Guy, tell us a little bit about your story in regards to what you're doing to help people sustain recovery, find recovery, and also live.
Yeah, well, first off, thanks for having me. And this is my own personal experience, and I understand that there's many paths in recovery, and I hope everybody finds their path. For me, I started using drugs when I was 12. There was a lot of verbal and physical abuse in my childhood, and I was always searching for ways to cope, and drugs helped me cope with that. And, you know, when I first found substances, I thought it was the most amazing thing in the world, but it also turned into my worst nightmare and biggest battle of my life. I found myself daily hanging out in the downtown east side at a very young age of 13 in 1983 till about 1993. And then from 1993 to 2013, I was homeless and literally consumed by the progression of addiction, living in a 2-block radius, trying to survive and cope with pain. I not only survived the HIV crisis, where 1 in 4 in that community were positive for HIV, but I had also survived the overdose crisis in 1997. I've survived 5 osteomyelitis bone infections, 4 in my left leg, 1 in my back, where I had to relearn how to walk again. I'd also survived the induction of fentanyl in 2012, where I was brought back to life 6 times. And I made numerous attempts throughout my journey in recovery, and I just never gave up believing inside that I could recover. I'd always believed somewhere that I could. My last overdose was the hardest thing that I'd ever dealt with, and it broke me literally physically, mentally, and spiritually. And I knew inside that if I stayed any longer that I was going to die. And the on-site detox helped me get into a recovery program out in Surrey, BC. And then I went to an outpatient program 5 days a week, and also went to daily Narcotics Anonymous meetings. And you know, what really inspired me about going to the meetings was the physical connection that I'd see with others that left the downtown east side. So it inspired me to that I could actually do this. And you know, now almost 8 years later, I'm married to my beautiful wife Brianne. We have our 2 children, Noah age 5, Gia age 4, and 1 due in 6 weeks. And you know, I appreciate not only the support from everybody involved from both sides of things, from the harm reduction services sides, but especially from the recovery community, because it's literally changed my life. And I always say that I really wouldn't be alive today if there wasn't harm reduction services, but there's no doubt that I wouldn't have the life I have today without recovery. And I hope this inspires people that we do and can recover.
That's beautiful, Guy. And yes, beautiful wife, beautiful children. Congratulations on 8 years. So we have many crises. You know, this was going to be just about COVID, but the reality is it's not just about COVID. There's homelessness, there's poverty, there's access to treatment. You know, what are you finding from your day-to-day some of the biggest challenges right now for people to sustain recovery, to even find recovery?
Yeah, good. That's a really good question and good points. I mean, even before, I honestly don't think there really is a great pathway to recovery. I think that's what needs to be really looked at. I think, you know, that they have they call it a system, but the system's broken. The opportunity or the window for somebody to receive help, especially to make that jump into recovery, needs to happen ASAP, not a wait list for a month or a month and a half. This is completely defeating for people. And then, my challenges is with really right now seeing people that are brand new in recovery. They're lacking that physical connection that you get from entering a meeting, the electricity that happens in meetings and meeting people. And sometimes the most important thing was probably the coffee and the conversation after the meeting. And it's something that's lacking in today because of COVID. So it's really impacted, everybody on all sides. And it's not, it's great that people reach out by phone, but it's not the same as that human connection piece that we need. And hopefully, we can get out of this and get back to what really helps people.
So one of the main issues is the conversation about recovery and what is recovery, and there's so many conversations about that. What does recovery mean to you? Like, what is recovery to you?
Yeah, well, recovery means, just improving the quality of my life, having the ability to show up, to be present in people's lives. I mean, for me, that was the hardest thing. I couldn't do that in my addiction. I couldn't show up and be involved in people's lives. I couldn't even really show up for my own life. I mean, I was so literally entrenched from the getting to using that it was literally, destroying my life. The great thing that recovery has given me is just the ability to actually improve on that. And I'm not making the same mistakes over and over again and having negative consequences. I'm actually making positive decisions, which has really impacted my life. And I think that's one positive decision isn't going to change 20 years of an outcome, but multiple positive decisions in a row can really start changing a person's life and making them feel like that they've gained some control over it, because I didn't have control over my life in addiction. And so I had to be taught how to learn that. And that's what, was the most humblingest thing for me in recovery, is that I didn't learn those as a child, and I needed somebody as I got older to teach me that. And that's what recovery means to me. It means, just being humbled and to try to learn to do something different. And you know what? It finally, gained some traction in my life, and I'm just really grateful for, recovery.
Yes, thank you very much, Guy. If you have any questions for Guy, please put them in the chat. Guy will be back to summarize towards the end. And just want to remind everyone that this is not about people who casually use substances, or this is a conversation to help people who have substance use issues, addiction, whatever terminology you want to use. But how do we inspire recovery into people who are looking for recovery, and how do we do that during crises? Scott, I know a bit of your personal story. We really wanted to get you to say a few words. Your story's a conversation that's a bit different. If you wanted to share a bit of how and why you needed to find recovery.
Yeah, so a little bit about my background story. I grew up on the west side of Vancouver. From an outside perspective, I had a pretty, picture perfect family. I didn't grow up with any abuse or anything that would necessarily be considered traumatic. I had a great time growing up, but much like Guy, around age 12, I started to get a bit of freedom, and I used that freedom to use drugs. Moving on to 15 years old, I started to kind of discover party drugs. And then by 17, I had first tried heroin. And then after about a year later, I was regularly using heroin intravenously. And you know, obviously, it's not a very sustainable lifestyle. It didn't take much time for me to end up, you know, using on the downtown east side. And you know, I'm a little bit more, you know, I'm definitely pretty fresh-faced looking. I got taken advantage of quite a bit down there. So I wasn't suited for that lifestyle whatsoever. But so I burned out quite quick. You know, I was kind of couch surfing a little bit down there. I stayed in quite a few SROs and, you know, really wherever I could. And yeah, that's, I mean, it really was just an empty and horrible lifestyle. And the reason I continued to put myself through it is because these underlying mental health issues and these feelings of not belonging and lack of self-respect and lack of self-esteem, that I continue to put myself through those.
Now you're, I think you're at a place. How old were you when you got introduced to recovery?
So it wasn't until, you know, I had tried a lot of things to get clean, and it wasn't until I was 21 years old that I had my first real introduction to recovery. I had tried a couple SMART recovery meetings before that to sort of appease the people around me. So yeah.
And your perspective then in regards to getting into the healthcare system, how did the healthcare system help you even get introduced to recovery?
So that was the funny part. This was around 2015 when I first got into recovery. So I know there wasn't as much in place, but you know, I've overdosed you know, multiple times. I've been to the hospital for overdoses around 5 times, if my memory does serve me. And every single time I went to the hospital, pretty much I was Narcaned, and as soon as I was conscious and it was apparent that I wasn't going to slip back into the overdose, I was ushered out. And I do remember having conversations with my GP about the drugs I was using and how I was using them. And really at no point was I offered any form of recovery in the sense of treatment or counseling or opiate replacement.
So you had an intervention done on you, you went to treatment. Do you feel that you had privileged on that because of being able to access?
Yeah, absolutely. So the way I was introduced to recovery was through a private interventionist, and he recommended the last door in New Westminster. And you know, through that, it was private pay, so my parents funded my treatment stay. I didn't have any way to fund myself, and the contrast of seeing other people who don't have access to that funding. You know, seeing the hoops that they have to jump through, especially if they are in an income bracket where they're making roughly above $20 an hour, but maybe not consistently enough to be put on EI. You know, in terms of the gap of accessibility that I had to treatment compared to them, it's enormous, really.
So when we were talking, Scott, to get you know, asking you to do this, one of the outcomes was, you know, to really raise the awareness that everyone should have the same access that you do, regardless of financial capital and so forth. So thanks for speaking out about that and bringing to awareness that this is another story that Canadians and British Columbians are experiencing. And hopefully by the time we're done these 4-part series is that we have some solutions out there so people have the same access that you did. Now fast forward, you're in recovery, you know, a few years. You're working in a high-risk trauma area. You know, if you want to share a little bit about that, and how do you sustain recovery in the line of work that you do, and if you can share as much as you would like in that field.
Yeah, for sure. Well, thanks for asking. So after getting clean, I started working in the field of biorecovery, which basically means Any job that involves, we basically clean up after traumatic scenes like murders, suicides, body decompositions, and much more recently, a lot of viral outbreaks. And yeah, it can involve some traumatic events. You know, I've cleaned up. You know, being in recovery, I do know a lot of high-risk people. You know, who are more likely to end up in these incidents, and I have cleaned up quite a few of my friends and people that I've known quite well. And
So with the minute, for the less than a minute that we have, how do you sustain recovery in that situation?
So being introduced to a social model of recovery, you know, I mostly find myself using the community that I've been involved in through the treatment center I went through, 12-step meetings, reaching out to friends, and really just utilizing the social model of recovery. And I have seen a counselor a couple times, but I wouldn't be necessarily doing that without being introduced to a social model.
Okay. Well, thanks for the courage for sharing your story, Scott, and taking some time off of work today to be here with us. I appreciate that. And if you have any questions for Scott, you know, please pass them on through the chat and so forth. And Scott, appreciate your time. At this time, I'm going to introduce Jessica and Carson. Hello, Jessica and Carson. And they are going to take over and bring some conversations and maybe talk to and ask some questions to our three guests as well. Carson, Jessica. Carson, Jessica, would you like to go first?
Yeah, I can go first. For those attendees that maybe work frontline or have experienced the loss of friends and colleagues as a result of the overdoses that have been happening recently, I want to let you know that there are supports available, and if you need them or considering them, definitely direct message us and we'll connect you with some counseling options. There's a lot there, and I also want to send my condolences for those losses. I know they're pretty recent for some of us, especially this week. I want to thank Guy and Rebecca and Scott for participating in our first ever webinar. I want to thank BC Center for Substance Use for hosting this. Very much appreciated. And you know, when it comes to recovery, I think Rebecca touched on it, is that there is no one universal definition of recovery. And you know, what Guy said about it's important that you find the path and get in where you fit in. And if you do want to access treatment supports or recovery supports, that there are many available. And there's a lot of people out there that can help you bridge the gaps that we all know exist in our healthcare systems and help you keep on keeping on. If you don't have problematic substance use, this is by no means a webinar to criticize your choices by any means. This isn't to stuff down a certain opinion about recovery. This is just to raise the national conversation about recovery and raise that there are available resources. When I think about COVID and the pandemic, I'm just wondering what any of the speakers have about forecasting what you've seen as far as innovation or resources pulling together to help those that are vulnerable in their recovery journeys. Have you seen anything locally or rurally or nationally that maybe the attendees aren't aware of yet?
I'll jump in there and say a few words. Yeah, I guess we're going back and forth on it. But before I do that, I'll just say, echo Jessica's comments. Thank you, Guy, Scott, for sharing your stories. It takes a lot of courage, and we need more of that. I know historically there's, the principle of anonymity, but I think, while that served us at times, I think it's also, created a condition where there's a lot of questions about recovery. And I think, for those of us in recovery and know what's possible and know how big that constituency is, I think it's really important that you share those stories. So thank you for doing that. And Rebecca, thank you so much for making the time. Jessica, to take a stab at your question, one of the things I've seen, actually just having a conversation with a friend the other night who's been going to various meetings, whether it be at fellowship, mutual support, is that the accessibility and the comfort level and the speed with which the digitization picked up in the recovery community for folks to not only find the time, but to be able to, come together. Certainly some early hurdles, but, I think just the feedback I've received anyways is the comfort of being able to, be in your safe space, be it your home, your work, wherever that may be, and the sort of added benefit to that, I think that's, an interesting sort of anecdote. I do think that connection being such a, central tenet of what we do in this time of disconnection for all kinds of public health reasons is certainly a concern. So, I think for me, the most impressive thing is just how rapid, the recovery community responded and took, an in-person connection program and into the digital world to support, themselves, the newcomers, what have you. So, yeah.
And I guess another question that I have that often comes up for the panel, any of you can speak to this with your experiences. How have we continued to bridge the gap between recovery-oriented services and public health harm reduction services? Where do you see successes? Where do you see things that are working well? And why do you think that is working well?
I think maybe I'll quickly note some of where we're hearing some good success stories is where people are coming together who may not normally work together, and different sectors, so housing, harm reduction, primary care, public health. That table has really been created through the public health crisis. But has also resulted in the realization that bringing those folks together can lead to more comprehensive solutions. So some of those discussions hopefully will continue beyond the crisis in order to have ongoing benefits for just connecting the dots. And I think Guy said it very well, that the system as we have it is broken, and starting to bring together some of the different components of the system will help to make it more accessible.
Yeah, we've heard it a couple of times today that the system is broken, and I've heard that many times. Guy's in an amazing position, being that he's advocates for many people in the downtown east side. But I know Guy believes that addiction is not just in the downtown east side. Guy, if you could fix that broken system, and it's just like, you're in charge. What are some of the things that you think we need to do? And I'll make sure that the right people hear this, Guy, because you're down there. You know that there's people that use drugs that aren't on welfare and aren't in the downtown east side, and that people that are down there. So removing their social status, or whatever you want to call it, what do you think we can do to fix this system to initiate recovery?
Yeah, when I'm in the downtown east side, and people are inspired because they knew me for so many years. So it's not a typical conversation of, drugs. It's always a conversation about how did you do it? And really how I did it is, the pathway that existed at that time was really a nurse at the supervised consumption site and on-site detox that really developed and knew, like, hey, this guy will die. We have to try to do our best to give him all the options. And the one option that, I'd been in and out of my life was always, I could see recovery happening. I just had a hard time achieving that or finding that. And so, when you're struggling in the downtown east side, I think you have to look at, if you have to have some sort of outway or pathway that allows people, we have like safe supply, we have harm reduction services, but really what we also need is to show the option that, hey, there is options for recovery. Come on in. If you want us to help you, have case management to actually porthole you to a program that exists. And the other problem that, when, like I always say, even if people are wanting to go, the challenge is then breaking through the barriers to get them in. And that's just feels hopeless for the person. And, even a couple weeks ago, you know, a girl called me from the Budsy Hotel wanting to get out, and it was so challenging. Luckily, she got out, but it took, like, you know, a good 10, 12 days of trying to help her. And sometimes that's just exhausting on the system. There just needs to be, you know, a landing spot. In BC, there just isn't a centralized system that can get people that are struggling into recovery if that's what they want. So it just doesn't exist.
We're supposed to be going into Q&A right now, but I have one question for Carson and Jessica that I think we need to touch on. Recovery, treatment, recovery, not the same thing. When we, you know, if Jessica, if you could possibly highlight on that, like in a quick soundbite, and Carson, if you can do a quick soundbite before we go into Q&A. Accessing recovery during COVID does require, for some people, treatment, and how is accessing treatment during COVID changed, and what can moms and dads that may be listening, you know, who may be fearful of sending their loved one to a place where there's lots of people. So Jessica, if you can just do a quick soundbite about recovery treatment, and Carson, accessing treatment during COVID.
Sure. I mean, I know that the recovery movement has evolved from people with lived experience in recovery, and many started sober houses, and there's a big, you know, 4-decade-long history on that if you want to delve into that. However, many people affiliate treatment centers with recovery, and they're two completely separate things. There's thousands of people across the world that initiate and sustain their recovery that never access any of our professional services. I think that sometimes recovery is overshadowed, or people are deterred from pursuing recovery because of specific treatment centers models, or they've had a terrible experience with mutual support groups or a counselor or whatnot. So part of challenging the stigma, and I know Dr. John Kelly just did a research on this, and he'll probably be publishing it later this year, about people's perception of sickness and the disease model and what recovery actually looks like, greatly impacts how we show up for the people asking for our help in our professional capacity, and in our personal lives, how we discuss what recovery and wellness look like. So again, I want to, you know, challenge the attendees here to really consider that treatment is just a way to initiate or reinitiate someone's attempts at recovery. There's no one size fits all, and that recovery happens vastly and the majority outside of the professional walls of the services that they may or may not access.
Thank you, Jessica. And Carson, for those that, you know, there's probably people listening who have a loved one that have some issues with substances. Is it safe to go to treatment? I know you've said on lots of stakeholder meetings in regards to accessing treatment during COVID-19. Any comments on that?
Yeah, I mean, the reality is that it absolutely is safe to go to treatment. The provider community is a tight-knit group, and it's very close from day one, sharing policies, best practices, you know, and something I'm certainly proud of to you know, be part of that group and how everyone's responded. So in terms of, you know, the access to centers, you know, it's absolutely safe. And I think one of the things that resonates for me is, you know, and salient in our patient community today is the realization of the two public health crises that is going on, and you know, the folks that are coming in to initiate that recovery journey, you know, realizing that they're suffering from a disease that you know, has the potential to take their life as well in quite a destructive way. And you know, I think if there's anything in terms of initiating recovery, Giuseppe, that strikes a chord for me, it's sort of, you know, twofold, and it reminds me a bit of what I was thinking when Guy was talking, because I've heard Guy's story, and it's an important story that needs to be shared, and it reminds me of recovery in general, where we've got this sort of relationship between motivation and clarity that exists, and you know, I think oftentimes we, you know, place a premium, rightfully so, on motivation, and folks are motivated, but they really lack clarity, and we undervalue the importance of that. And, you know, and I think clarity in how you can access supports, what supports are right, what, you know, and how you actually can initiate that journey in a sustainable way. And if, you know, if a relapse is part of that, that's not a you know, a life sentence, that's, you know, it's a chronic relapsing neurological disease. And so I think, clarity for folks that are trying to initiate recovery. And I think in these times, given the lack of a systematic oversight from sort of the health framework in the country, and this explosion of digital tools, it's just clarity for those parents that are looking at various programs that would be best to fit. And I think that there's some really good provincial, national organizations out there that can help navigate services that are at the right time for the right level of risk.
That's clear. That's a great way to put it, clarity, because sadly, Google, in Scott's situation, I know if it wasn't for Google, he would have started his recovery, and we shouldn't have healthcare based on what you find on Google's first page. Now it's time for Q&A. Amanda, I believe, is somewhere.
Yeah, hello, I'm back.
Hi, Amanda.
Hello, so I've actually got a question here for Rebecca. So Rebecca, on the topic of stigma, how much do you think the stigma for people, or that people experience, is connected to the ongoing criminalization of people who use substances? What can we do to overcome the stigma, especially in the time of COVID-19, when incarceration is associated with increased risks? Quite a question for you. Go ahead.
Huge question. I mean, fundamentally, we know that looking at substance use as a criminal issue versus a health issue is inherently stigmatizing. So we definitely need to change the narrative so that we focus on substance use as a health issue, and recognizing the risk of incarceration during a pandemic. We have an opportunity to look at what's happening in the community right now, where we have drastically reduced our prison populations. How have we achieved that? Is that sustainable? What are the impacts? So these are questions that are really fundamental to be asking right now. So thank you for the question.
Great. Guy, a question for you. Does recovery also mean abstinence?
Yeah, no, it definitely does. And I think you have to have all options, especially in these challenging times. If somebody picks their pathway to recovery, that's great, but your pathway is your pathway. Let somebody else discover their pathway, and you just be supportive of it. And if somebody came up to me in the downtown east side and said they didn't want to use drugs and they didn't want to get on any medications and they wanted to go in the recovery route where they didn't have to be on anything, then for me, I support people's journeys, whatever it is, whether they use drugs or not use drugs. My journey is I can't use drugs, but that might not be somebody else's journey. I'm just really along the ride for people's journey, and I just want to support them where they go. And I think that's the biggest thing that I've learned in my life, is that I needed support to get to where I am. And guess what? So do people need support when they're struggling. And whatever decision they make for their recovery journey, I just want to be there to support them. So I support all models of recovery and all models of harm reduction. Always have, and I always will.
Well said, Guy.
Thank you.
All right, a question for you, Jessica. So how important is language when we're supporting people in their recovery journey? For example, clean, like getting clean, does that mean that I'm currently dirty?
Well, I work at Lobster Recovery Center, and many of our clients attend mutual 12-step groups, and one of their goals is the language they use is that they define part of the recovery as their amount of continuous abstinence, and they refer to that as clean time. I will respect the language that they use. However, in newspaper articles, in policy documents and whatnot, I think that we need to be professional and respectful, and I'll refer to what other panelists have said, is that how someone describes themselves is their autonomy, and we need to respect their path of recovery. How I describe them is based on what the research has provided me this year. I know that language is ever evolving, and that how we tackle stigma and talk about each other and about people who use substances professionally is ever evolving, and we're continuing to learn. I think there's been a lot of mistakes made, and at the end of the day, the most essential practice is compassion towards people who are looking for help or trying to find their pathways to and of recovery. And I'm not going to tell them what they can and cannot call themselves.
Great. One final question here, and I'll direct this one to Carson. Carson, if folks choose to attend treatment recovery centers, do you know if harm reduction is also being taught there and supported?
I mean, I can't speak for every center out there. I mean, that's part of the challenge would be the lack of oversight and regulation in that regard. I think that, you know, in centers that have a full, you know, spectrum of care from, you know, medically supervised detox through treatment, you know, practicing evidence-based medicine in that regard is an important factor. I think it's a bigger conversation around, you know, what qualifies and constitutes evidence today. I think that's a term we pretty loosely throw around and rapidly jump at, you know, various novel approaches, and when maybe they're just that. But, you know, I think that the reality is we have risks today with opioid, you know, particular and others, not that that's exclusive to that would, you know, merit, you know, using these things as tools, but they're not singular focus. I mean, that's, you know, medicated assisted therapies are a tool to use for durations that is between a practitioner and a patient. But that's not recovery in and of itself. Recovery is a much broader existential experience, and I think that's an important, you know, delineation that I think gets confused. And I think we talk a lot, and rightfully so, especially in British Columbia, about the opioid component of this. And you know, I'm you know, concerned as a Canadian, just looking at the reports that the CCSA has put out about the prevalence of alcohol consumption in COVID, and we all know, certainly on this panel, that, you know, alcohol is the predominant substance in the country. That's, you know, the unfortunately the silent killer, given, you know, the headlines of other drug classes at the moment.
Thank you very much. And I recognize there's many questions in the chat, so we'll try to collect those and stay with us during this series. We'll try to get to those questions and address them as they come up. So if you still have more questions that we can't get to, again, mention them in the chat, and we'll try to carry those over into future sessions. And maybe we'll ask our panelists as well if you have some juicy ones for us. But with that, I think we want to make some final remarks. So Giuseppe, I'm going to hand it back to you to lead us through that.
Thank you so much, Amanda. Thanks for everybody for asking those awesome questions. Those questions are on everyone's mind. I get asked those questions pretty much on the weekly. So we definitely, Guy, you heard those questions. Do you have any comments on any of what was said? And then we'll go to Scott.
Yeah, you know, I think, you know, if in Canada, the overdose crisis is, you know, an undeclared national emergency. We need all hands on deck right now. Everything from safe supply, harm reduction services, to recovery services for everybody. People should be allowed to, you know, I often say this too, you know, people struggling in this day and age with the contaminated drug market, they don't get the opportunity to make it to recovery because they're dead. And so we need to actually look at the beginning to move people through the pathway that they can actually be alive one day to get to the possibility of achieving their recovery goals and their pathway. And so that's why it's so important to look from both sides, from the beginning and then, you know, the journey, because there's really no destination or ending spot for recovery. It's just a journey that needs to be so that people are kept alive to make it on that journey. And that's my hope that happens across this country.
Scott, you don't work, you're one of the only ones on this panel. You don't work in healthcare. You used heroin and you ended up going to rehab, and now you're in recovery. What do you make of all this and the questions and some of the responses as just a person on the sidelines?
Well, what do I make of all it? I think it's great. I think there's great dialogue going on. You know, I love to see, you know, obviously it's a super new industry and there's so many different moving parts to it, from harm reduction to abstinence-based treatment. And it's really good to see everybody working together and you know, moving forward, because really this has been an issue for far too long. And with the recent uptick of overdoses has just been catastrophic, and it can't be allowed to carry on like this. So thanks everybody for getting together and doing this.
Rebecca, any final thoughts?
I just say that COVID has really shone a light on a lot of the cracks in the system right now, and we can't look at going back to normal. We need a new normal that is better, that fills those cracks. The research tells us, and Carson made reference to the survey that's indicated approximately 20% increase in, about 20% of Canadians who have increased their alcohol intake. We know that people are facing stress and anxiety, and the mental health and substance use impacts are going to be felt for years to come. So we need to make a better system to help Canadians achieve wellness and achieve recovery.
Thank you, Rebecca. Carson?
Yeah, I would just echo that, I think now is a time for coming together, and I totally agree with what Rebecca said. It's whether we like it or not, there's going to be a forced reset. I think that there's some preliminary data that indicates that the overwhelming sort of underlying majority in the country of the working wounded struggling with addiction is going to exacerbate, and we need to have a system that can respond at all ends, and that rate from harm reduction through recovery, and respond in a timely manner. It shouldn't take someone months or weeks to link between care. It should be when that person is in that moment ready to go, because the cost of not could mean someone's life.
Jessica? Oh, but you're on mute. I can't hear you, Jessica.
Okay, sorry about that. I do want to continue to shed light on the research and evidence that we have, reviewed as far as recovery, that many people, what they use to initiate their recovery, they don't necessarily use it to sustain their recovery. That 12-step fellowships are well known. Some people find them really effective, some people don't, but there are many, many resources available both for free and public and private that can help people sustain their recovery and reinitiate or initiate their recovery. So if you need help, just keep asking for it, and we'll do our best to link you up and keep helping you, and stay safe.
And part of the reasons why we're doing these webinars is so when you ask for help, like Guy said earlier and the rest of the panel here, that all opportunities for help are there, from consumption sites to outpatient to detox to oats to opportunities to get abstinence if you wish, and all of those pathways are respected. I want to thank everybody on the panel, and Amanda is going to share some resources.
Yeah, just to wrap us up here, we do have links to a number of resources through both BCCSU as well as the CCSA. And so we're going to provide a link to this recording on our website, as well as these slides. So if you'd like to take a look at the bios or the resources available, we'll have those up there for you. Of course, you can always email us if you have any further questions or concerns or need anything. But with that, we'll close this session. So a huge, huge thank you to our panelists today. I thought that was a great discussion, and I really look forward to the rest of the series. I hope folks on the line can join us. I think we're just going to continue to build this conversation through sessions 2, 3, and 4. So with that, thank you so much, everyone. Really hope you have a great afternoon and stay safe out there. Bye, everyone.
Thank you, everyone.
Bye. Thank you.
Bye.